All right, very good. All right, I'd like to call to order this meeting of the Sacramento County Board of Supervisors. It's a special meeting for Wednesday, December 30th, 2020. Madam Clerk, will you please call the roll and establish a quorum?
Yes, Supervisor Frost?
Here.
Kennedy?
Here.
Natoli?
Here.
Peters?
Here.
And Cerna?
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel, on the Comcast Consolidated Communications and AT&T Uverse cable systems. The meeting is closed caption and is webcast at sacmetrocable.tv. Today's meeting will be repeated Sunday, January 3rd at 6 p.m. on Channel 14. This meeting is also broadcast live on KUBU Radio on 96.5 FM. A DVD copy is available for checkout from any local library branch.
Great, thank you very much. Supervisor Tully, will you do us the honor of leading us in the pledge this morning?
Okay, so wherever the flag is close by, please rise. I pledge allegiance,
Pledge allegiance
to the flag
to the flag
of the United States
of America,
and to the republic for which
Republic
it
for which it stands,
one
one nation.
indivisible. Lost my audio.
Thank you. So again, this is a special meeting of the Sacramento County Board of Supervisors. We have one item, agendized item today. We also have the opportunity for the public to address the board on items not on the agenda. And with that, is there any other announcement that the clerk needs to make before I make my announcement about these special circumstances?
No, I will make my announcement when I read the item into the record.
Very good. Okay, in compliance with directives of the county, state, and Centers for Disease Control and Prevention, the CDC, this meeting is live streamed and closed to the public. Temporary procedures are subject to change pursuant to guidelines related to social distancing and minimizing person-to-person contact. Of course, we do welcome verbal comments telephonically from the public. To do so, please dial 916-875-2500 and follow the prompts to be placed in queue for a specific agenda item or off-agenda matter. Please refer to the agenda and/or watch the meeting to follow along to determine when is the best time to call to be placed in queue to make your public comment. You may be on hold for up to an extended period of time, and your patience is greatly appreciated. When I open public comments for a specific agenda item or an off-agenda matter, clerk staff will begin transferring you into the meeting. Each agenda item queue will remain open until the public comment period is closed for that specific item. Of course, the public is also able to provide the board with written comments as well. You can do so by sending them via email to boardclerk@saccounty.net, and Sac County is SACCOUNTY. Your comment will be routed to the board and filed in the record. Again, we want to thank you for your patience.
Okay, so for your first matter, this is item number 1, the expenditure proposal for unspent and unencumbered coronavirus relief fund revenue. I do have a note on the record that in your staff report in paragraph 1, there is a correction to the date where it says that the board approved on December the 22nd. The corrected date is December 16th, and this updated file will be in the record after the meeting.
Very good, thank you. And before we hear from, I believe Bruce is going to start things off, Mr. Wagstaff. But before we start the presentation, I just want to make some opening comments about this agenda item. And it has to do with the fact that, as a reminder, those that participated from our staff, as well as public that were monitoring the last meeting of the board, you will recall that there was some interest by the board expressed to interrupt regular winter recess so that we did not let any unnecessary time and consideration pass when it comes to the urgency with which we want to make sure that the balance of CARES Act funding and other resources to address the pandemic are appropriated and set in motion. So that's why we are having today's special meeting, and I had a chance to coordinate it with our acting county CEO based on a conversation she and I had last week. So again, I want to express my appreciation to all of our staff, especially our clerk of the board staff, for making the arrangements that you have so that we can deliberate this important matter today. So with that, we'll begin to hear from staff. Thank you.
Well, Mr. Chairman, thank you very much. This is Bruce Wagstaff. I hope you can hear me okay.
Yes.
And just very briefly, I would say that since your last meeting where you took the action that we discussed on December 16th, public health staff have been working extremely hard to put together a plan that you're going to hear about this morning related to the reallocations that we did that day, specifically the $8.8 million from last year, as well as the unencumbered funds related to what's in their budget for this year. So I want to thank Dr. Kassiri and her staff for the work they did on this nonstop since our last meeting. And I believe Dr. Kassiri is prepared to present the plan to you today.
Very good. Thank you.
Thank you. Good morning, Mr. Chair and members of the board. Can you hear me well?
We can.
Yeah.
Great. Thank you. So before I go into my PowerPoint in Florence, I'm hoping you have that available.
We do.
Yes, I just wanted to give an update on the numbers so that we know where we're at. And this is an update for yesterday. We are at 63,898 cases reported. And we're averaging about 664 cases a day. So this has actually dropped a bit because prior to Christmas, we were averaging over 800 cases a day. Our case rate is at 42.3 per 100,000. Has also dropped because prior to Christmas, we were averaging over 50 cases per 100,000. For deaths, we have 833 total, and we have had an addition of 6 cases, 6 deaths in one day. And again, here we're also seeing a drop because prior to Christmas, we were averaging 10 additional deaths per day. So it does seem as if from the trends that there seems to be beginning to head in the right direction, but it is still too early to tell. And also we have not seen the impact of Christmas and the travel that our residents did during that time. So we are still very cautious about the direction that the numbers are going. And then for the vaccine, we started receiving vaccine last week. Public Health has received a total of 14,000 doses. 4,000 of those are the Pfizer, which requires the deep freezing, and about 10,000 is Moderna. And this week, actually yesterday, we started doing vaccinations through our clinic. That was a soft launch because we are trying to make sure that our nurses are accustomed to dealing with the vaccine and making sure that we have no wasted doses. But we are planning to quickly ramp up after the new year, and we are working to bring on additional partners, such as some of the universities that we have here, and also some of the clinics that have offered to be able to take doses from us so that we can have more places where people can be vaccinated. So for Sacramento County as a whole, we have received so far 42,525 doses. We get allocations weekly, and it depends on what the state gets. So we don't know how much we're going to get on a weekly basis, but our plan is that we will be able to start receiving all of that and then be able to distribute it to our partners. And right now we are still at phase 1, tier 1A, which is vaccinating the healthcare workers. And people in the long-term care facilities. And lastly, just wanted to update you on the intensive care unit capacity. Sacramento, the greater Sacramento region has remained around 15%. Sometimes we've dipped a little below that, but over this last week, we've actually remained above 15%. And this morning, the number we got was 17%. But when you look in general at California, you can see that there's still a dire situation, especially in Southern California, where they're actually -0 capacity, and the California as a whole is also at 0. So the question that we've been asked is, as we're coming up to the 3 weeks with the stay-at-home order, whether the state is going to allow us to end the stay-at-home order, and they haven't made a decision yet. They're still looking at projections. But from what we've been told, especially looking at the overall California numbers, and also the fact that the projections suggest that we might still dip under 15%, that they might ask us to hold on. We will, as soon as we hear more, we will let you know, but that is the status right now. So that's my update. And before we go into the PowerPoint, just wanted to pause and see if you have any questions.
Thank you, Dr. Kasiri. Any questions by our board members?
Here, it's Don.
Supervisor, go ahead.
Yeah, thanks, Dr. Kasiri. So just on the last point, because I know it's been broadcast certainly in recent days at least on television media, about the pending decision by the state as it relates to the whether or not the stay-at-home order would be lifted or modified. In the event that it is, though, then it would allow to reestablish outdoor dining and some of the other aspects of services that have been curtailed during the stay-at-home order. So I guess I'm curious what it would mean if it were lifted, and secondly, if you would anticipate that they might extend it, but because we've been maintained, most days anyway, we've been over 15%. Would it be for a shorter period of time potentially, or would it be for the 3 weeks?
So if it is lifted, then we would go back to the purple tier. So
Okay.
If you recall the restrictions that we had, such as allowing just outdoor dining, and also there will be restrictions still on retail. But still, they would have to allow us to do that. So we're hoping that by the end, we have to hear by the end of this week what the decision is. And so I think that it will become clearer once we know for sure. And then your second question, I forgot.
Yeah, well, it was just that in the event that, because they're going to do these projections, that they would extend the stay-at-home order, would they, because they talked about these 3-week blocks, but, at least under the criteria that was outlined, would you anticipate if they were going to, because projections might show something different, would they do it for a shorter period of time, or are they sticking to 3-week blocks for the stay-at-home order, as far as you know?
My hope is that it will be a shorter period of time. They have not told us for sure, because
Okay, right.
want to, then the projections they're making will be for a 4-week period. So again, that will be detail that I'm hoping that they'll provide to us by the end of this week. And also to point out that even though our numbers, we've remained above 15% in our region, but because of the dire situation in the rest of the state, especially Southern California, we can expect that there might be a situation where they might actually ask us to be able to accept some patients from Southern California if they are completely out of beds. So that's part of the reason also why they will ask us to wait until we see what happens after the new year.
Okay, just one other follow-on question then. So the former sleep train arena has been now being utilized. And so are folks who have COVID-related symptoms, or are they the folks that are being treated in that facility? And if so, if we were asked to accept overflow capacity for other Californians and other regions that were being negatively affected as related to overflows in the hospitals and so forth, would they go there, or would they come to our hospitals? And then, so who makes the decisions about who goes to the sleep train facility?
The state is managing the sleep train facility, and they would make decisions as to who goes there. But the resources that they have at the sleep train facility are only able to help with patients that need hospitalization in general, not for intensive care unit because of the special equipment that would be required for someone in the ICU. So that's why it's so critical, because we have only a limited number of ICU beds in the entire state. So if, for example, we were asked to take ICU patients from another region, those would have to go to our hospital.
They would, okay. Okay, that helps. That clarifies. I didn't realize that. Okay, thank you. Thanks, Mr. Chair.
Yeah.
I have a question.
Yeah, Supervisor Frost.
Thank you, Chair Cerna. I was wondering, Dr. Kassirier, it seems reasonable that there are a lot of hospitals in Southern California, and there are many rural areas in between us and Southern California. And so it would seem like they would transfer patients, overflow patients to the nearest hospital. How are they looking at, how are they rationalizing where they'll send the patients? And do we have an idea of what the status is of the hospitals surrounding it, closer to Southern California?
That's correct. As they're looking for where to transfer patients, they would look initially at the areas that are closest to Southern California. But again, when you look at the numbers, both Southern California and the San Joaquin region are at zero. And in fact, according to the estimates from the state, it's probably in the minus as they're beginning to use additional surge beds. So it's possible. I'm not saying that it's going to happen right away, but it is possible that they would get to a point where they've used up the available bed within the southern region, including San Joaquin. So that means that the next region would be the Sacramento area, and county being the largest in our region with the largest hospitals, probably they would contact us.
So there is potential that they will want us to stay closed based on the possibility that we might be asked to accept overflow. And how are we supposed to what are we supposed to say to our businesses who are dying on the vine and our families that are trying to figure out how to survive? Under that scenario, we're not being treated the way they said they were going to treat it. So I'm just curious about that.
As I mentioned, again, there are two reasons why they would ask us to continue the stay-at-home order. One was because of the general status of California, but the other also is the projections, and knowing that we might expect that there might be an increase in cases because of Christmas and New Year's, and the projections do indicate that we will drop below 15%. So because we are still in that cautious period, that is why the second reason why they would ask us to wait.
Is the surge capacity calculated based on the overall available beds or based on the number of units open with staffing?
It's based on beds that are available with staff.
So there might be hospitals in in these different areas that have more beds if they opened those wings and staffed those wings?
They've looked at all of those options, and right now, actually, and that's why I said that is actually in the negative, even though when you look at the records it says 0, because they are using those surge beds as well. And the state has been looking for additional staffing, and they've actually even put in requests for to other states for nurses, especially.
And are we looking at the possibility of possibly changing the way we look at the way we staff? An example would be bringing in specially trained assistants who can assist the nursing team so that we can add the number of service personnel.
Yes, the state has actually waived the nurse patient requirement to be able to help with that as well.
Oh, thank you, Doctor.
Thank you.
Any other questions for Dr. Kassiri?
Yes, I do. This is Susan.
Supervisor Cooper, go ahead.
Thank you. Dr. Kassiri, maybe I missed this in your discussion of the numbers. So we're at about 16.5% availability in our ICU, the last numbers that I saw. So if they send us patients, if Southern California sends patients up here, do we have a floor so that we can handle our own citizens and residents here in our own hospitals, or are we then going to be sending them to other states?
As far as prioritization, we would prioritize our own citizens, and as far as for Sacramento County, we would definitely prioritize our own residents of Sacramento.
Well, I understand prioritizing, but what happens if the beds are full of sick patients from another area?
I think that's something that is being monitored, and I know that there are discussions with the hospitals as to how that is going to be handled.
I mean, it seems to me that we need to set up a number of either by percentage or number of beds available in that, at the moment, 16.5%, how much we're going to have available for patients out of the area, so we have room for our own, that you are telling us that there will be more because of the Christmas holidays. So I just want to be able to protect our own residents. That's what the answer I'm looking for.
Yes, that's part of the plan, is to make sure that we are able to take care of our own. And also the state is looking at additional guidance that will be provided to hospitals for critical care, to be actually they call it crisis care, which means that it's a situation where it's not business as usual in terms of being able to take care of patients. My understanding, but I haven't gotten an official report on it, is that might already be happening in Southern California, in terms of looking at how they can increase the use of the resources that they have right now, and that will include things such as putting up tents, and also.
Yeah, I'm sorry, I understand that. So please, you don't need to repeat yourself about what they're doing in Southern California. I'm talking about residents here in the Sacramento, this new region that's been put together by the governor. So how do if we're going to have a surge of Sacramento region patients after Christmas, how do we make sure that they have a room in the hospital if we're going to be receiving overflow patients? I mean, it seems to me there has to be some kind of written understanding of some X number of beds that are available.
Yes, and actually before they transfer any patients, they will do what they call a bed poll and ask how many beds are available. So the hospitals are looking at that and making sure that they do have some that are still available for our residents.
So we're leaving it up to our local hospitals to have I don't want to use over a surge capacity, because that has a different connotation, but we're looking to them to come up and hold on the number of patients they will accept from out of the area. Is that what
That's
you're
correct.
Pardon me?
That's correct, yes. And we
Thank you.
get reports from them as well to so that we know what the status is.
Thank you.
Okay. Supervisor Kennedy, any questions for Dr. Kidd? I do have one question for you, Dr. Kusiri. I had a conversation with the head of one of our local labor unions here in the region yesterday. They had reached out to me wanting to understand whether or not Sacramento County would likely, I guess, use or develop a committee system of sorts to prioritize availability, access to vaccines. And the person that I spoke with cited some other counties that are currently looking at that as a mechanism to conclude how vaccine rollout would occur. Is that something that we're looking at?
So what we're doing right now is following the tier system that the state has set up. I think probably what the person you talked to was referring to was prioritizing or making sure that we're able to get vaccine to the disadvantaged communities when we get to vaccinating the general public. And yes, we do have we have had conversations with some of our community-based agencies in terms of how that will look, but we're also planning to have a committee that will be able to monitor this and provide guidance as we move closer to that point.
Okay, thank you for that. I think their concern was actually more about essential workers, not that they don't care about disadvantaged communities, but I think the context of their question was really about essential workers, some of whom they are representing, and so that was kind of the genesis of the question. So I appreciate the detail that you just expressed about how that might occur.
Sure. So the state does have a committee that's reviewing and giving guidance on the different tiers and priorities. So that's what we've been following. We've also gotten a lot of inquiries from different groups and individuals about where they fit in the tier system. So if we're not able to clarify that with the information that we have been sending that over to the state. At this point, we are not looking at having a committee that will look at the essential service workers because that information is already provided to us by the state.
Thank you very much. Okay, if there are no more questions for Dr. Kusiri regarding where we are on the numbers, we'll move on to the next part of the presentation.
Thank you. So if we could go to the next slide. Okay, and I do apologize that there are a lot of words on the slide, but we wanted to give you as much information as possible. And I'm not going to read every word to you, but just in general to point out and remind ourselves that where the money is coming from, the $14 million, as Bruce pointed out, is part of the $45 million that was approved for the public health response in August. And if you recall, we presented you with a budget for a 6-month period, and we started implementing in September. So we've basically used up 4 months of that 6-month period. So the $14 million is basically a representation of what we would use for the remaining 2 months. And so it's more of a continuation of the operations that we have been working on from the 42 million. I mean the 45 million. The other 8.8 million is unspent funds from the previous fiscal year, and that was also added to the public health budget. And so I know that that's probably where you have a lot of interest in terms of what happens with that money. So we wanted to present you with what our plan is, and then provide you also with information about some of the requests that we have received and how we decided on the programs that we have so far. And so with the first page, it just gives you some of our assumptions, the fact that many of the line items are an estimate based on how we've been utilizing the funds for the previous 4 months. And it's also conservative in that we know that we have a limited amount of money, so we're really prioritizing what we think would be our top needs for this period of time. And also, we're very appreciative that the way that the approval was given, there was enough flexibility so that if we needed to make changes or move money from one line item to another, that we could do that. And we were actually able to make changes when the request came for the Wi-Fi in the park, and be able to meet those needs as they came up. Also to point out that we are aware that there's some additional CARES money that's coming. Right now, we don't know how much Sacramento County will get. And we also don't know what the requirements will be. We've just been told that some of it will be for vaccinations, but as soon as we are able to get confirmation on the amounts and what it will cover, what we've discussed with both Bruce and Jim is that we would present them with an adjustment in our budget and be able to move more of that money over to some of the other needs, for example, those in the community. So next slide. So this is just an overview for the 14 million and showing you the larger pots that where the money is going, and it actually almost evens out with about a third for staffing, about a third for operations, and then a third for outreach. And then the following page, we go into some more detail. So the subsequent pages are actually provide more detail for each of the 3 buckets that we showed on the previous slide. So on this one, you see for the staffing detail, we've had to hire a lot of nurses for contracts, and most of them have been helping us with being able to do testing at the different test sites, for example, at the Cal Expo, and also being able to provide flu vaccine to some of the long-term care facilities. So now that we have started getting COVID vaccine, many of them are actually going to move over to be able to assist with the vaccination clinics. And we are hoping that early in January, we will be able to start providing vaccinations at Cal Expo as well as the other sites. And then overtime, this is if we do have money in there for regular staff for their overtime, and then if approved again for management as well. And I know that Anne has been discussing this with Dave Devine, so we will wait for a final conclusion on that.
Mr. Chair, this is Supervisor Peters. Do you want questions page by page or at the end?
Why don't you go ahead and ask them as we progress through the presentation. Do you have a question for Dr. Katsiri?
Yeah, yes, I do. On the overtime for managers,
Yes.
the definition of a manager is that includes they don't get overtime, and that's one statement. And the next is if we were to approve this, it would affect the budget countywide, and we'd have to go into bargaining for all of the labor units. So I don't know why this is even in the budget, or even in, this isn't a budget, but you're calling it staffing detail.
Sure. So
That's inappropriate.
yeah, so right now there is an ordinance that in a declared emergency, that management staff are able to get, but the maximum right now is 100 hours.
Right.
And when they made that available to us, the management staff used that up in 1 month. So we've continued.
Dr. Kassir, I understand that, but if something like this should come back in a separate item before the board, so it can be discussed and all the ramifications of it. Maybe I ask county council's thought about this, just including it kind of lump sum in this with very little discussion.
Right. So we have not spent any of that money on the management staff beyond the 100. And we have it in the budget, but again, that is why you see on the slide it says if approved, because we do understand that it.
Well, but Dr. Kassir, what is it if approved? Meaning today, or through a budgeting item later, or what?
No,
Can maybe Ann or County Council answer that question for me?
Yes, this is Ann. I'd be happy to. Can you hear me?
Yes.
Yes.
Okay. So I have been in conversations with Mr. Devine, understanding the challenges of overtime for managers and all of the implications. And this is not to be approved today. This does have labor implications. We're looking at some alternatives to overtime to help support the managers that have been, working tirelessly on this.
Right.
But this is something that we will. It's a labor issue. We will likely come to you in closed session with options, and that's what we're working on now behind the scenes.
Okay, well, it's not to disparage the work that the staff has been doing, but given the, at least my feelings about the amount of money that's going to be available in the budget next year, it just, that's going to be a very tough thing to approve.
Understood.
Thank you.
Mr. Chair?
Yeah.
Actually, Supervisor Ntoli, I saw Supervisor Frost had her hand up. So
no problem. I guess I don't know if my audio was working here or video. So, okay, that's fine. Yeah, I'll wait. Thanks.
Supervisor Frost.
Thank you. I just wanted to add that I was under the impression through all this that we had personnel available that could help with those, temporary personnel. It's written into our existing contracts how the overtime for the managers is to be handled, and that there has been temporary personnel available that could be utilized that wasn't utilized. So I'm just wondering if we're making sure we're taking advantage of the staffing that we've set up as the contracts were written in the protocol that's set forth.
I'm not quite sure I understand. The contracts that we have, we've actually been able to use both on-call and contract staff for the work, but that has mainly been as line staff. For the management, it's not that easy to be able to bring in additional managers to be able to assist with the work. For example, when you look at the incident commander, you have to have knowledge about how to run a public health emergency using the ICS system, and have to have knowledge about the different activities that go into that. So, and again, we have this as a placeholder, and as I mentioned, beyond the 100, we have not spent any additional money on this, and we will wait to hear what the board decides before we move on.
Is this a conversation that's going on then with Ann? Maybe I'm asking you, is this a conversation that that is ongoing with the bargaining units, between the unions and the bargaining units, or is this a request from staff?
Both. Staff have definitely requested this, and Schema, who represents the manager, have also reached out. They did have some meetings earlier in the year. I just received a letter from Schema this week offering some additional possible solutions. So again, it's a conversation that we will need to have with labor, and so Dave Devine and I and Bruce and others are working on that.
Thank you.
Supervisor Natoli?
Item, in my view, and again, I appreciate certainly Ann and Dr. Kassiri attempting to work through this, obviously with our labor representatives, counties, on the management side, but certainly the recognized bargaining unit. But these are extraordinary circumstances, and you had a department that was pretty lean in staffing going into this. Nobody, knew where this was going to take us. This journey, so to speak, extraordinary circumstances. We haven't seen like this in our country in 100 years or in the world. And granted, contracts are binding. They're relevant. They're relevant not only to the employees that are represented, but obviously to all of our employees that are working through this. But I think it's really important that we have an ordinance that provided for 100 hours, and I haven't got to imagine, let alone know some of the circumstances from people that have reached out to me over the past several months, actually going back earlier to the spring, that as Dr. Kassiri says, that and folks were working and continue to work tremendously long hours and so forth, and in this public health realm. And yes, there have been as we've gotten into this deeper, have made additional resources available. But in those early months, March, April, May, and certainly all the way through to this very time, people have really stepped up in the public health realm. And I for one, am very interested in seeing how we can work this out, certainly in fairness to all of our employees, but certainly to those employees in this particular area in the public health arena who, again, they may have management coverage and obviously what comes with those responsibilities and certainly those compensation packages. But again, I see some very extraordinary circumstances here, and I'm very interested in seeing us try to get this resolved. So I would just say that I appreciate, Ann, what you just said. I didn't realize Schema sent a more recent letter. So hopefully working with labor, we can figure this out and recognize the good work that was done and compensate appropriately.
Thank you.
That's all I had. Thanks.
Okay, any other questions before we permit Dr. Kassiri to address?
Yes, I have one more question.
Okay.
I'm back on this item. I agree that it should be worked on. I just don't want it to be lumped into this whole item and then just disappear and get approved at a staff level somewhere. I think it needs to come back to the board so that everyone can know what's going on. So thank you.
Okay, thank you. All right, Dr. Kassiri.
Okay, thanks. We'll move to the next slide. Which is operations. So the mobile integrated health units, this is a collaboration with EMT medic teams that have been going to the long-term care facilities to provide testing. And it's been greatly appreciated. And and of course, because right now, especially with many of them having outbreaks, they have to do weekly testing. So we have negotiated extension of contracts. And so below you see the list of the agencies that we have been working with. And each of them has one or two units that they have made available. And they actually have a website where the facilities can request testing, and they have divvied up the facilities into regions so that it makes it easier to coordinate. And so that will be ongoing. The other thing also is that these units will be used to assist us with vaccinations. We're in the process right now of being able to get a waiver in place so that the paramedics are able to give vaccinations as well. And that will increase our ability to reach in to especially some of the disadvantaged communities as well as the homeless communities. And then with the lab, the 300,000 is mainly for lab supplies as well as being able to have courier service, because oftentimes we've had to actually have specimens sent to the state, especially at times when we have maxed out on our capacity. I also wanted to point out actually that with the budget that we were able to get additional machines, and now we have ramped up our testing. Initially, we were doing about 5,000 tests per month, and now that's at 8,000 to 9,000 tests per month. So that has been successful and is ongoing. So the public health lab supports mainly testing at jails and with the homeless, with paramedics and first responders, and also in outbreaks. And then with the vaccination, now that is beginning to ramp up. Sorry?
Yeah, excuse me. Supervisor Frost?
Yes, Dr. Kasiria, you mentioned the vaccines, and I know I can speak for myself. I think it'd be so great if we could prioritize the vaccines to the highest risk populations. And you mentioned homeless, and I thought we had almost zero COVID among our homeless population. And I might be wrong, but can you refresh my mind on the status of, what is I thought it was the Latino Black community that we were having a higher incidence of COVID deaths.
Yes. So when we get to the point of being able to provide the vaccine to the general public, yes, we are going to look at those numbers and make sure that we prioritize the communities that have been hardest hit. As far as the homeless, the reason that they are put in a higher category is because many of them do live in congregate settings, like in the shelters. And if there was to be an outbreak in one of those facilities, it can spread very quickly. And actually, recently we did have a small one in one of the facilities, and fortunately, because of the quick action of the staff in being able to isolate those that were positive, they were able to control it. But definitely, and that's part of the reason why we need to have the different partners so that we can focus on the different groups at the same time. So when I talk about prioritizing the homeless, it doesn't mean that we're not going to be able to prioritize some of the disadvantaged groups. And again, as I mentioned, it will also depend on the tier system that the state provides, because they have told us again and again that they're going to make sure that we follow the priority groups that they have given us. And so we want to make sure that as much as possible we keep to that. If we do have an outbreak in a certain setting, we can request and actually put that ahead of the other groups. But in general, we will keep with what the state provides to us.
So I wonder if we can get data on the COVID, the at-risk, who is at risk. It seems like it's hard. The state is telling us what we need to do, but it's hard to get the data that rationalizes what we're doing so we can understand it and so we can explain it to our constituents.
Sure.
And I know you're working on getting me something that I asked for 2 months ago, which is COVID by business class category. But I'd be interested in also having data, empirical data that shows me who is the high at risk, who are those who are the highest at risk, so that we can be mindful of the resources that we're thinking about and allocating. We can make sure that we're protecting the at-risk first and saving as many lives as possible. Can we get that kind of data? Specifically, COVID deaths by, I don't know if it's ethnicity or if it's whether they live in an urban setting versus rural. I'm not sure.
Yes, so we can definitely provide information with the weekly update. I know we have not sent that out yet for this week, so I can ask our epidemiologists to put together information that will show incidents by both the numbers as well as the rate for each of the race ethnicities, and also incidents and also the hospitalization and the deaths. So I think that will give you an idea of which groups have been at highest risk.
And I would be interested in understanding the data on COVID only versus COVID related.
Well, we'll include a definition of how we count the cases, because when you say COVID only, COVID does cause things like pneumonia, so that has to be included. And there is a definition that we use when we count deaths that are due to COVID or COVID related. So we can provide that information as well, but only the cases that have that are caused by a person having COVID are going to be counted. I also wanted to point out again the reason that it has taken so long with getting the cases by business is that it's almost like data mining.
Sorry, that's my bad.
The information is in the text, and so our epidemiologists actually have to go in and pull that information out. So they are working on it. It does take a while because it's not as easy as pressing a button and being able to get that information. So we're still working on it.
It seems like that information at the state level and at every local level would be imperative to know in order to make thoughtful decisions about people's mental, spiritual, physical, and economic lives. It seems like the state, if they're making these decisions about shutting our entire economy down, sending our kids home from school, all these decisions we should have data input that allows us to pull reports on a regular basis that gives us this information so we can see the big picture. I don't know if you can have that conversation with our representatives at the state level, but we're used to getting information, looking at information, and having information to base these important decisions on. And it seems like we're in a fog. We're not getting answers on a lot of important data that would impact decisions that we're making. I mean, I know you're doing the best you can, but we need information, and we need to understand. We need to understand as we're making decisions about how we're going to allocate funding. It could be a matter of lives that we're saving. The data could make a difference in the number of lives we can save.
Sure, and at the state level, they are looking at risk-based information that in helping them to make their decisions. And so I can ask them to provide that as well, the data that they used, and provide that to you.
Thank you.
Mr. Chair, I have a question too.
Supervisor Peter.
Yes, Dr. Kassiri, in the second section on your slide under laboratory testing, you have a sentence that I'd like to get a little more explanation. It's the last sentence in that paragraph. Does difference between budgeted amount and projections may need to be supplemented by other funding sources? What does that mean?
That means that, for example, in that statement, it talks about that the projected need for the 7 additional months is 636,000, and yet we have set aside only 300,000. And so there is additional money that funds that we received from the state, that and the money that we receive from the state gives us specifications on how it can be used. So part of that is for lab support. So that's where we will get the additional money that we would use to get to the 600,000.
Okay, it wouldn't come out of the 8 million we're going to discuss later.
No, it will not.
Okay, and then back up to the mobile integrated health units. You're talking about expanding existing contracts. It'd be helpful to know for how long. How long are we extending these? Is this a 1 month extension or 6 months or what? It's very vague. Well, there's more information, so it's more than vague.
Sure, this is a 6-month extension.
From what date?
From January to June, because the contracts that we have right now were due to expire at the end of this month. And so the extensions would go from January 2021 to June 2021.
Okay. Mr. Chair, when we eventually get through the section, I need to go back to the first couple of pages. I had questions, but I didn't ask because I wasn't sure what we were doing. So just wanted to put that on the record there.
All right.
Thank you.
Go ahead, Dr.
All right, so we'll move to the next slide, which is the outreach.
I did have a question.
Oh, Supervisor Tully?
Yeah, I'm sorry, Dr. Kasari, just real quickly on that last slide, on the vaccination distribution and dispensing, you mentioned that, obviously there are more CARES money forthcoming, and with this latest stimulus package, there's, if I recall, just from the general information, there's some significant sums of money, not knowing that's going to trickle down to us, in there for vaccinations. So will you have flexibility within the context of that category in the event that those dollars flow to us? Obviously, the vaccination effort will be ongoing for a number of months. Do you anticipate you would use this 2.1 million, and what period of time would this cover? If this 2 million, would this take us through June in your anticipation, or just through March? Or again, I'm just trying to get some sense about that.
Sure, the 2 million was for the 6-month period, and so
January. I'm sorry, January to June of 21, or this was from the past 6 months?
January to June of 21.
Okay.
And what we have discussed with Bruce and Jim Hunt is that once we know how much money we will be getting from the federal government that we'll be able to use towards vaccination, then that will free up the 2.1, either the whole amount or part of it, and that will be then moved to the outreach section, and that will also be information that we will be able to come back to you on in terms of what your priorities would be. If that makes sense.
Immediately, yeah, it makes sense, and that this would allow us to continue vaccination efforts and to ramp those up as you've outlined in some of the previous slides. Okay.
That's correct. Mm-hmm.
Yeah, thank you, Mr. Chair.
Hey, Dr. Kay.
Okay, so with the outreach, can we go to the outreach slide, please? Thank you. So with the outreach, when we first set this up in August, we had set up a contract with Sierra Health Foundation And the reason for doing that was that we felt that it would help us in being able to move this money quickly, because with that one contract, Sierra Health Foundation was able to contract with about 14 or so other community-based agencies to set up a system for referral and assistance to people in the different neighborhoods that needed help. So they called it the SAC Collab, and I think the last slide actually shows additional detail as to what that's, and we'll come to it when we get there on page 9, what the kind of services that SAC Collab was providing. So our plan is to extend that contract, and in so doing, be able to continue working with all of the community-based agencies. And they would continue with most of the work that they've been doing, such as the education and outreach, financial assistance and meals. But with this new extension, we would not include the contact tracing. And the reason for doing that is that the contact tracing will be covered by both a software system that we set up called Qualtrics, and also it will be done by some of the nurses that we have that are continuing to work on the with our teams. Then Housing for the Harvest, this is a contract that we have with La Familia, where they are providing assistance and support to people who come down with COVID or are affected by COVID, and they work in either farms or food processing. And there's been a request that this be continued. And so we're in the process of negotiating how much we'll be able to put towards that. And with the Homeless Task Force, I know that it only mentions targeted testing and food service here, but it will actually include some of the work that Dr. Bielenson had started with, being able to provide wash stations and additional support that will complement what the Homeless Task Force is doing. And then with the interpretation, because of course we're dealing with a lot of different communities, we have had a lot of need for these interpretation and translation services. And we'll need them even more as we're doing outreach for the vaccination. And that's all I have for the 14 million. So I can go to the 8.8 million spend plan, which is the next slide.
Actually, Dr. Kassiri,
Yes.
before we do that, I believe Supervisor Peters had a couple questions relative to the 14 million. So why don't we have her ask those questions and you address them?
Sure.
Supervisor Peters?
Sorry, I had you on mute. So back to page 2, which is the budget planning assumptions.
Yes.
You have estimate, conservative, and flexible. So under conservative, under budget limit, it says that the budget is constrained by current amount available, is generally minimum amount necessary to continue response. And how are we supposed to interpret that?
I think it's just an acknowledgement that there are additional needs, because we had actually developed an additional one-year plan for 45 million, but of course knowing that was it just in case the federal government did approve additional money for the counties, but it's not, and that will be provided if that money becomes available. So I think that's just an acknowledgement of the fact that we are aware of the budget limits that we have, and we want to be able to keep within that budget.
Okay. For someone outside the county reading this, it would have been good to have a sentence that says waiting to hear from federal government as to state, additional funds. But anyway, then go under flexible and future funding. The last sentence says, depending on new funding constraints, line items could be shifted to new funding source and or additional response needs could be funded. So I assume that means if we get more money from the federal and state government, when you talk about a new funding source.
Correct, yes.
And where it says additional response needs could be funded, are those things that would come back to the board?
Yes.
Okay. Then the next page, page 3, under outreach, you've got 4,083,000 minimum projected need to continue vastly scaled down community outreach and support efforts. I'm questioning what you mean by vastly scaled down.
Yes, because with the 42 million, the budget that we had initially had a total amount of 16 million, but definitely how much we have right now, we're developing a budget that would fit within the $4 million. And also, yeah, so that's basically what that means over there.
I'm sorry, I didn't really follow that. So you're spending 4 million plus, and you're saying that's a need. So is this, you're considering this to be new money because it's the 14 million, but it's going to be scaled down outreach?
It's scaled down, as I mentioned, because, for example, with the new contract starting in January, we will not be asking them to do the contact tracing. And also it will be dependent on us being able to remain within the $4 million.
Okay, well. But you think with the $4 million, you'll be able to do community outreach?
Yes.
It's the vastly scaled down outreach that I'm not following, whether that's kind of going to be solved by the 4 million, or you're still going to have a scaled down outreach after you spend the 4 million.
It will be a scaled down outreach, because with the 4 million, we, knowing that we want to keep within that budget, we will have to decide on which efforts they're going to be able to focus on. So, and the reason for the comparison with the scale down is in comparison to the initial contract we had, which was the 16 million, and they were able to do a lot more outreach at that point. So we will have to prioritize and make sure that we are able to meet the greatest areas of need. And also, again, as we get more money freed up, our hope is that we will be able to add more money back into the outreach section.
Okay, it's just your terminology. You know, if you're a regular citizen reading this, you'd think that we're not doing enough on the community response. So, and then actually on the front page, this is more a question for Ann Edwards and Bruce Wagstaff. This board letter is unsigned. There's appears to be no one from the administration who has approved this. Is that correct, or it was just left off the board letter, or what does this mean?
It actually was approved by both Bruce and myself.
I couldn't hear you, Ann. What?
I'm sorry. It actually was approved by both Bruce and myself. I can't speak to the signature piece right now, probably because we were doing this so quickly, but we can certainly correct that. But it was approved by both of us.
Okay, I think, yeah, it should be corrected.
Yep.
I've gotten 3 or 4 copies of it over the last 2 days, and none of them had an approved by. Okay, thank you.
Supervisor Frost?
Yes, I'm wondering if, I'm having trouble wrapping my head around, is this your plan then, Anne? Is this your final plan? Because I had the impression there was a lot of changes coming in the first of the year that could impact the way this money gets used.
So as Dr. Kasiri said, there is a new relief bill that was signed by the president on the 27th. We don't yet know how much money that we will receive, but we do know some of the categories. So there will be some money for testing and vaccine distribution to underserved populations. There's a fair amount of nutrition and food support. There's some emergency rental assistance support. But we really have to wait until we get our allocation in those categories and know what all the rules are around spending it. And if we get a sufficient allocation, let's use testing and vaccine distribution, for example. We've set aside a fair amount of money for testing and vaccine. We could possibly free up some of that money and replace it with the new CARES money, and then that money could be utilized for more outreach or more of the kinds of things that we aren't proposing to fund today because of a lack of resources. There is more to come, probably late in January.
But you need this. What is it that is the emergency today that we have to do today?
Well, you all weighed in pretty heavily that you wanted to let us know how you wanted to spend this money. So this is a proposed plan that Public Health developed. You'll see at the end of the presentation there are some additional options of things that we aren't funding, and it will give you all an opportunity to support this plan or tell us to redirect some money in other ways.
And I just want to say I don't think of a budget. I've never seen a budget like this. Usually when I see a budget, I see numbers and allocations. It's hard to know what contracts are signed that are, that we have to deliver on versus money that's discretionary versus money that has to be spent in certain areas. And usually, in the past, we've always had a breakdown of the numbers. And it's like we have big numbers and that have words that say how they're going to be, what our intent is. But, this seems unconventional. Are you going to come back with an actual budget? This doesn't look like a budget to me in what I think of as a budget.
Yes, it's certainly not what you're used to seeing when we have a budget hearing, for example. I would call this more of a spending plan than a budget. There's a lot of detail behind all this, and I think Dr. Kasiri can speak to that. But this was to get your approval on the sort of the big bucket areas of where we are intending to spend the money. I believe that we got authority at the last session to extend these contracts, and there was on one of the slides a list of many of the contracts that we'll be extending through the end of June. And again, Dr. Kasiri can probably speak in greater detail to that.
All right.
Can I chime in here for a sec? Because I want to make sure that all my colleagues understand kind of the structure of what we're considering here, because I fully acknowledge that it may be unconventional, but again, if we go back to what action we took in August, that was the action on the overall $45 million for public health. We were given some very broad categories from Dr. Kasiri in that memo. You recall the action that we took on the 16th was to make sure that we preserve the ability to appropriate the unused amount of that $45 million past December 31st, which is the $14 million, which is the first part of this presentation. The second part of this presentation is really the guts of what we're considering today, because the 14 million is already encumbered, as has been mentioned several times, but it's the 8.8 from what was not spent in the 1920 part of the CARES Act that we're really going to be hopefully engaged in conversation about here shortly in terms of adjustments. And that really is for me, from my perspective, that really is the most important part of this special meeting. Again, the reason why, to Supervisor Frost's question, why the urgency? Why do we even have to have this meeting? It is because, as Ann mentioned, the board expressed interest in keeping our collective thumb on the pulse of how this money is being spent or encumbered or appropriated, pick your verb. And we didn't want to let much time pass just because of a winter recess, so that we could, do everything possible relative to the 8.8, especially to make sure that we're doing everything we can to respond adequately given the resources we have. So that's the way I understand it. I would look to Dr. Kasseri to correct me if she thinks that I've misrepresented anything, but there's a lot of moving parts here, but that's generally the construct of what we're being asked to consider today, as well as the information that Dr. Kasseri has provided relative to what has already been encumbered.
So the goal today is basically to make firm decisions on the direction of those funds.
The 8.8.
The 8.8.
Yeah.
Okay.
Hope that helped.
It did. Thanks, Phil.
Mm-hmm. Dr. Kasseri.
All right, thank you. So we'll go to the next slide, which is the presentation of what. Slide 7. Okay, thank you. So for the 8.8 million, this is what we're presenting to you. And again, as has been mentioned, this is money that was unspent from the previous fiscal year and was added to the 45 million that had been given to public health. So our proposal was to use it, 1 million to put it towards a food program. We were presented with a request from the restaurants to have an expansion of services that they're already providing, similar to the services that they have for the seniors, as well as expansion of the Family Meal Sacramento. And so this would be starting off with the 1 million, but of course with the understanding is that if it is your desire that we would, as new money is being freed up, that we would add more money to this, because actually in their proposal, their full proposal was for 5.7 million. And we'll come to that slide that shows some more detail. And then for the testing, this is a contract with STEM Express that has been providing the lab that has been providing the testing services for our community test sites as our tests for the long-term care facilities. They've been doing about 4,000 to 4,200 tests per week at about $120 per test. And so our plan is we're actually working on being able to transition over some of those services to our expanded public health lab capacity, as well as the state lab capacity. There's a new state lab that is beginning in January. So our plan is to be able to move the services there, and that might free up some more of the 7.8 million. But in general,
Dr. Kasseri, sorry to interrupt. Supervisor Kennedy has a question.
Thank you, Chair. Dr. Kasseri, under food programs, it's $1 million minimum projected need to support new food program initiative. How does this fit in with what we were already doing, like things like the Dine in Sacramento and all of that? Are we pivoting to a new program now, or are we adding on to what we were doing before?
It would be adding to what is being done already. My understanding from at least the email that we were sent is that the restaurants have a couple of proposals that we would have to explore with them as if you decide that this is the direction you want to go in. And it would be very easy to pivot to that because basically it's, I guess this is a project that is really shovel ready. And there are a few programs that they've had. One of them is the expansion of family meals and working with the schools to be able to supplement the free meals that the schools are providing. The other, my understanding also, is that the program that we have for the seniors, the funding goes through February, so this would actually help in being able to extend that beyond February.
So again, back to, we were doing Dine In Sacramento. Is that gone?
Olivia, if I could help, this is Bruce speaking.
Sure.
Supervisor Kennedy, it is not gone. It is operating through, with the funding we have, through the end of February. We're serving about 700 folks a month with that program. And as the doctor was saying, that to the extent we get additional funding, some of the funding that is targeted in the new stimulus bill is for food programs. Again, the details we're hoping to get soon, but it's our hope that we can look at that and look at the whole picture here with food programs and look at the possibility of not only what Olivia is talking about here with this new effort, but also the potential extension of the dine-in program.
Okay, because I just want to express again, as I have on numerous occasions, my support of this program because of the dual purpose of not only helping people who need food and are hungry, but also of helping businesses maintain, give them something to do that's productive and keeping their lights on.
Agreed, and we felt the same, and so our hope is that you would allow us to be able to move forward with that, and definitely would work with other partners in being able to put actually maybe we don't even need a contract if there's a contract in place already that would be able to move that money quickly.
Yeah, I just want to make sure that we're not going to be creating a new bureaucracy.
No.
And we're putting as much money on the street as we can and in the hands of small business people who are hurting.
That's the goal.
Okay, thank you.
Yeah, Ann, did you have a comment?
I would like to add a comment. Thank you. One of the items in this new package, which should be really helpful to families, particularly families who are eligible for free lunch programs, is there's going to be a 15% increase in the CalFresh benefits starting January 1 through June 30th of next year as well. So that's a 15% increase in their CalFresh benefits, which will also help support their purchase of food.
Thank you. Supervisor, yes.
Yeah, thanks. I'm going to just go back on the dine-in home program again. Certainly, I've heard some very good comments back, both from folks who received the services, but also from some of the restaurateurs that have participated. And Bruce, you said we're serving 700. I thought we authorized up to 1,000 folks as we ramped up. And my question to Ann the other day was, in a very short conversation on this, was that, even if it's funded through February, that I understood it was going to be beginning to wind down because you have this subscription list. So are we holding any new participants in the program? And if so, I want to be sure that, I'm all for, supporting families and to offer this additional assistance to others in need, but not to lose focus, particularly with stay-at-home orders that are, as we talked about much earlier in the presentation, that is currently in place. And there's a prospect that they're going to be extended for any period of time. I guess I want to know a little more detail, if I could, from somebody as to, whether we're no longer adding new folks, we're winding it down, we're holding it static. because that program, again, has proved very successful. And the other question I have about that is that in the event they're winding down, what sort of transitions provided? Meals on Wheels has been stretched. It's a different approach, but we've now identified, several hundred folks, many of whom I'm sure will be eligible through Meals on Wheels. What's the plan? Again, it's not all within the public health realm either. Certainly our Area 4 Agency on Aging is our partner in this, and the restaurateurs, but that's a lot bundled in one question. But I guess I'm curious more about the status as we embark upon another initiative here, one that and I thought we had actually authorized 30% more than what you just described relative to the number of participants in that dining at home program.
So, Supervisor, this is Bruce.
Yeah.
So the number has, our Department of Children and Family Services has worked closely with the Area Agency on Aging, as you know, and the number has fluctuated. And yes, they are, they have looked towards how they would have to ramp down. This was primarily before the federal stimulus bill was passed, not knowing whether or not additional funding was going to be coming. So I've talked with Michelle Cajellas about this, and we want to make sure our restaurants are poised to be able to continue operations, and we're in close contact with them. So it's our hope, Don, that by beginning of February, we will know the extent to which this allocation for food programs is coming our way, and we can work quickly to extend the program, working with the Area Agency on Aging, and of course with public health as well. So yes, it's been in a state of flux. They've had to have discussions about how they would wind down, as you mentioned, but the program's been very successful, and we want to be poised to continue it if it's at all possible, because as you said, we've gotten lots of good feedback. It's been great for the restaurants. Michelle has information on the number of jobs that have been retained because of this program that I can get you. So I can assure you that if there's anything we can do to keep this going, we will absolutely do that.
Okay, so let me just, and I appreciate the response, Bruce. So within this allocation, we're talking about, $1 million that would initiate a complementary effort for families and for students, working with obviously, some of the same, restaurateurs, maybe other providers as well. But if we're hoping to know more, but I guess so. The status is if we, and we're allocating dollars here, premised on, what we know certainly needs are out there, but also, the 7.8 million, for example, would it make sense to, allocate another 800,000 to dine at home program to make sure that we've got, some, funding that covers beyond a certain date? Again, recognizing what Dr. Kassiri said a moment ago regarding testing, and they'll hope that some of that money would be freed up because capacity could be shifted to other areas where we are getting either reimbursements or other dollars that would be coming forward for testing. And I don't want to diminish certainly the testing effort, but I just want to be sure that we're not on this course where 4 or 5 weeks from now, everybody's best intent that there's a ramp down and that we didn't anticipate today as we talk about this, that we can make sure there's funding, at least some coverage for the time that we're going to need to see what we can do to extend the program, assuming that there's dollars available to do that. So.
Yeah, well, Don, let me speak to that.
Yeah.
And Olivia, I don't mean to cut you off on this, so please chime in. But as I was saying, we have been operating that program just like the other aspects of our plan based on the budget we have, Supervisor. So yes, we've had to make some adjustments to expand the amount of time the program could last. One of the options before you today is a discussion about some of this money, as you just suggested, going towards the dine-in to remove some of the uncertainty that we have with what's coming from the new federal bill. I mean, that's a discussion we can have. Public health has identified their priority being this, right. But as Ann was saying, this is a discussion we can have with you.
Okay, well, just one other comment I would just say too, and then certainly hear from Dr. Kassiri, but that, again, we don't necessarily decide today, we're not going to wind it down immediately, but I think that, sending a clear signal, and, I have assumed this could come back to us as, more to be known by the time we reconvene on January 12th. And certainly by the 26th, but I guess I would just want to have some, level of confidence, I guess, that, whatever we do today, obviously there's dollars to fund it through February, at least a portion of February, but that we could give back to us if we didn't do this today with these broad categories, but make it very clear that you come back to us as quickly as possible with relevant information about what's forthcoming from the new legislation, but also how we are going to accommodate hundreds of folks who have had some dependency upon the program, but also obviously the economic benefit that has come to our community through the partnership with our restaurants. So, okay, well, that's enough. I don't know if Dr. Kassiri wanted to respond. Otherwise, that's all the question I had.
Actually, thank you, Don. I'd
Yes.
like to chime in at this point
Sure.
because I think there's some commonality perhaps to what you and I and perhaps others are thinking about the priorities that have been expressed here, especially as it regards to testing. And I certainly, I want to preface my suggestion, with I am very deferential to all of our public health expertise and those that have explained that testing is a priority. However, I would say, again, this is coming from a non-medical expert, but I would say that testing in January of 21 versus testing in July of 20 is a different priority. And the only the reason I say that is the circumstances are changing, right? This is a very fluid situation. We have the advent of available vaccines. We know that that's slowly rolling out, but I guess I openly question the need to prioritize so much of this 8.8 million for testing when we have more vaccinations by the day that are going out into the field. We have another stimulus bill that has been signed, and we granted we don't know what the amount is that we will receive, but we're going to receive something. And I would actually argue that perhaps one of the ways we begin to think about this 7.8 million is roping off a significant portion of that to augment, for instance, what is identified in terms of the food accessibility programming. Still, I'm very interested in small business assistance, restaurant assistance. I would go so far as to suggest that we, and this is arbitrary, but that we consider dividing that 7.8 in half and considering the balance of that for how we might do some of these other augment some of these other programs intended to help those that are not just suffering from exposure to the virus, but as been mentioned today and in several meetings past, is really hurting folks economically. So I just like to kind of put that generally on the table for my colleagues to think about as we permit Dr. Kassiri to conclude her presentation. But I really do think that we have an opportunity, especially with the 7.8 million, to think about how a good portion of that might be reprogrammed to provide assistance where we just haven't really been either able to provide it much in the past 9 months, or as it impacts those aspects of our economy and our county and our community, small communities in our county, how best we can help those folks that just haven't really received much from the county in terms of assistance. So I don't know if a 50% halving of the 7.8 million is the right number, but I think it's a good place to start. Dr. Kassiri?
Yes, sure. And we did anticipate from our discussions with Bruce and Jim that you might want to do that so we can make adjustments on our end. So if we go to the next slide, it actually gives you an idea of the requests that
Wait a minute. I think there might be some comments on the last proposal. If you flip back to the last page on testing, I mean, this is your proposal, Dr. Kasiri, and it's only for 4 months of testing, 16 weeks. So I'm assuming that's starting January 1st, correct?
That's correct, yes.
And we have more and more people getting it, and it's becoming more transmissible. And so why, I guess I'd like to hear your explanation of why you think we can shave some money off that and spend it somewhere else.
So 2 ways that we're thinking of that. One is that, as I mentioned, the state has a public health lab that is coming on board that is supposed to have high capacity, high throughput. So we already have staff who have been working to get that in place, so we would be able to move our testing from the STEM Express contract and be able to use the state lab, as well as also continue to use our local public health lab.
How fast, when is the state lab coming on board, and how fast is their turnaround? I mean, we haven't had great experience with some of those programs from the state over the last 6 months, 9 months.
Right. Their turnaround is 72 hours, within 48 to 72 hours.
And is our region the only one that's using the state lab, or, I mean, I'd like to know more about that.
It's available actually to all the entire state, and from what they've told us, they should have a capacity of up to 150,000 tests per day. So they're ramping up to that. And so that's one of the things that we are hoping to be able to pivot to.
When does this come on board?
In January. So we are right now working on making sure that we've submitted a request, and we have staff that are dedicated to seeing how quickly we can turn our testing over to the state.
Well, why isn't that on this slide? I'm sorry, this is very confusing to have you propose 7.8 for testing and then have an alternative for all of it. How are we supposed to judge this?
We are presenting to you the information that we have right now. And as I mentioned, these are proposed actions that we can take for January, knowing that, yes, the state is coming on board. As I mentioned at the beginning, that I said that as additional money is made available, we'll be able to move money over. So it's not a static budget right now or a static proposal. This is where we're at, knowing that if your desire as the board is to move more of that money over to the food programs, for example, that we would go back and see how we can move faster with being able to turn it over. The other thing also is that knowing now that there is money that is coming down that can be used for testing, we don't know how much yet. So again, our hope is that by the time we get to the end of January, we'll have more details on that, and we will come back to you with any changes that need to be made as far as the proposal that we have.
Okay, well, I'm very uncomfortable moving money away from testing and food programs. I'm just, to me, those are two very important items. And, and basing additional programs on, the state's supposed to have this or that program coming on board, it makes me uncomfortable. So
I understand your concern. And again, based on what your decision is, we can definitely go back and work on it and be able to provide you with additional information in January in terms of how much more money we are able to free up, and based on the additional information that we'll get in January.
Okay.
January's okay.
We were saying the end of January, so should we just continue this whole thing to the end of January? Till we know what's coming instead of,
Yeah.
That's possible, or you could allow us to start with the 1 million that we have right now, and then be able to make adjustments and come back with an alternate proposal as we have additional information.
yes, and the 1 million would be spent, how many months? I'm looking, how many months does that provide of kits?
If we go to the next page, it actually provides additional information from the proposal that we got.
The first 24 weeks of the year, I see that now. So that is, just under 6 months. That's what it would interest me. Is to don't assign this money to something other than this, because we may need it for these purposes. And then at the end of January, come back and say, okay, well, this program came online and that program came online, so we don't need this. So let's decide going forward. That's kind of where I am at the moment.
Right.
Mr. Chair?
Yes, Supervisor Tully.
Yeah, just piggyback on comments that both you and Supervisor Peters have made, that if I want to be sure I'm clear. So under the proposal that's on the screen, the 7.8 million would be 4 months of additional testing. Is that correct, Dr. Kasseri?
That's correct, yes.
So going back to what Phil put forward, if we did half of that, that would buy us through the end of February, or if you went with 3/4 of that, that would take us through the end of March. To this discussion about what comes back to us in January. It sounds like something's going to change. There's going to be some ability, again, yet unknown, both funding as well as with the state lab. And I certainly wouldn't disagree with with what Supervisor Peters said relative to some of the stop-start. But if they're going to have capacity that's projected to be 150,000 tests a day, and we've submitted for an apportionment of that for our community, then I would think there would be some ability to shift. But at a minimum, if we set aside 4 million, that would assure us through February that we would have sufficient testing, at least at the rate that is outlined here, the 4,200 tests per week. Right. That they would be doing, and would allow us to recalibrate to the points that are being made here. But and granted, even with the food, the $1 million is going to get us about 6 weeks, right?
Correct.
That's all. Yeah, so it's going to. So if we shifted more money there, put some in the dine-in program, or made it available for other things that either listed or not, I guess I don't see too much risk if we were to apportion. To my comments on this, a whole lot of apportion some of that. Either into food or other things that have been mentioned here relative to potential priorities, but certainly provided the backdrop for a testing regimen that would be consistent with what we've been doing, but would allow us to transition and give you some confidence as our public health officer that you've got it covered through a good period of time, at least the first 2 months of the year, or even more, I guess. It could go 6 weeks or something, but give us some additional dollars. Okay, that's the comments I had. Thanks.
Thank you.
I guess I just wanted this is Supervisor Peters' comment on Mr. Antoli's comments. It seems like, if I heard you right, Don, is to put enough money in both of those programs for 60 days till the end of February, let's say March 1st, the 60 days roughly, but sure, hold the rest of the money aside and see where we are.
Well, yeah, what's a whole? I mean, we could certainly allocate it. I think we need to, with keeping in mind, because that would then give us, a couple of $1 million additional. Recognize there's probably going to be some freed up. I'm willing to have the conversation about where we might put other dollars, as a part of the discussion here today. But I do think that assuring funding, to your point, for both of those through, a period of time, so that there's some definition for our health department as well as for board discussions yet to come in the year to come. So.
And if this is Supervisor Cernan, if I could put a finer point, I don't want to get ahead of Dr. Kassiri in her presentation, but I do believe the next slide is going to outline what some of those other programs, including direct services, we could, pretty swiftly provide assistance for with a portion of the 7.8, namely the support for childcare. Latino Economic Council has put forth a proposal to provide direct services and small business assistance in addition to other things. So, that was my thinking, is that, again, with the fact that, of course, testing is very important, but it's a, it's a different circumstance, at least in my opinion, when we actually have vaccines that are being deployed now, versus, not even being able to consider vaccination 6 months ago. That and the fact that we do have more federal assistance coming our way, I think this is the right time for us to think carefully about how to do a little shifting here, so that we can finally provide some assistance where, I'll be candid, where it's been absent for months. And, all of us, I think, at some point in time during our past hearings have mentioned that. So that was a little more detail on my thinking. Dr. Kassiri?
Okay, thank you. So we can move to slide 8. Thank you. So this gives you an idea of the proposals that have come in. There's one that came in after the presentation was created, so it's not presented here, but it's from Parks and Recreation, but it's very similar to the request that we got for support of child care services. But what we have here, the first row is the meal service. And so when we were putting in the 1 million as part of the 8.8, this is what we were looking at. And there can be more discussion about whether this is what we're going to support, or will it be the dine-in program. The next one of the clear scans, we did discuss that quite extensively. And thank you to some of the other directors who helped us with researching this. We decided that we did not want to go with the clear scans. Basically, these are machines that you would install in the doorway of a business, and it would take temperature for several reasons. One, knowing that we are actually moving to another phase of where vaccine will be more available, and the question was, what would happen to these machines after maybe a year? It's not clear that they would still be needed. The other would be enforcement as well. It would create quite an issue for the businesses to determine if somebody showed up at their doorway and their temperature showed up as elevated, what would be their next steps? Are they going to ask that person not to come in? And it seemed like the businesses might have some difficulty with being able to enforce that. There were also some information that came up that sometimes these machines are not that accurate. They might be off by 1 or 2 degrees. And so because of all of those points, we decided that we would not consider this line further. The next one is with child care services. As Supervisor Cerna mentioned, we've actually gotten several emails from the Child Action asking for support because they do provide child care services from some very needy families. And then the Latino Economic Council also submitted a request, and it shows you the totals for the different areas of outreach, direct services, and small businesses.
Supervisor Kennedy.
Thank you, Chair. going back to the ClearScan, and I don't know if ClearScan's the answer for technology or it's another company or what, but I will say that I have been in businesses like the Lotus Casino, who they actually don't find it at all difficult. When you walk in there, you can't get through the door without being scanned. And if you have a problem, which they have had, they say you can't come in. I mean, so I don't agree with the premise that it's hard to force. But private businesses have no problem, no shirt, no shoes, no service. So yeah, I don't necessarily. Now, whether or not it's medically valuable, that I will leave to Dr. Kassiri, your staff. But I also have always, and a lot of the small businesses that do participate in it have had a good experience. But I've also felt that from the standpoint of the fact that we're the second largest employer in Sacramento County, that if we just did things like this at our own facilities, particularly jail, I think that there's some value to it. So I hope we're not completely walking away from that.
And Supervisor Kennedy, I think you bring up some good points in terms of some of the larger businesses are able to use these successfully. For example, airports,
Right.
well as I think they would be really helpful in some of the county buildings as well. So that could be something that we could pursue. But in general, the proposal of purchasing 500 machines, we felt that, especially with the other requests that we had received, that this was a lower priority, but definitely being able to look at it for some of the larger businesses or county buildings, I think would be useful. Because what we've heard from businesses in general in enforcing the guidelines is that in some situations, especially if they have security on site, and which is again more of the larger businesses, that they're able to enforce it better. But we've also heard from a number of the smaller businesses where they've actually assaulted when they've tried to enforce, for example, the masking policy. So not to say that it's not useful, but to say that in terms of looking at the other requests that we were getting, that probably this would not be one that we would move forward with, except if it's being considered for county buildings and larger businesses.
Thank you.
Dr. Kassiri, just to dovetail off of Supervisor Kennedy's comments, that you mentioned that there's some question about the accuracy of these machines. My understanding, having talked to representatives for the from the Asian Chamber, who's that's the organization that has come up with this idea, that this is I'm not sure if it's the only brand of scanner or type of scanner out there that that has been FDA approved, but they are telling me at least that the accuracy is fairly competitive compared to other scanners, it being one of only a few that have been certified, I guess, by the FDA.
Sure, and this is not to discount that it has been certified, but my understanding from some of the research that we've been provided is that, for example, if somebody is wearing a cap or glasses, that there might be some distortion of the reading. And so keeping that in mind, again, looking at what would be most helpful for the businesses, that's the reason why we felt that we would probably not be going with this option. And I don't know if Bruce, if there's anything you'd like to add, since you were on the team that reviewed this.
Thank you, Olivia. No, I would just add that what occurred on this when the request came in is that our general services folks did some research. And as Supervisor Cernas said, this is not the only version of this device that's available. But they did, in their research, find some evaluative information that pointed out the questions that Olivia has mentioned in terms of potential accuracy to some extent, and also whether or not the person's got glasses or wearing a hat or things like that. So taking all those things into account, I think public health just measured the importance of this and the difficulties with it versus the other things that they thought they would want to prioritize for the funding.
All right.
Mr. Chair, this is Supervisor Peters. I have a comment. I think that these touchless temperature scans might, for a casino, maybe they've got security that doesn't mind getting into it, but most small business and, well, some large businesses like the grocery stores, they're not able to stop people who come in not wearing a mask. And much less say, well, I have this temperature scan that says your temperature's high. I mean, there are, wrestling contests in some of these stores and the grocery stores and I'm going to say like Target. I just mean department stores. I just think that puts the businesses in charge of security in a way that is inappropriate. So I think if you want to have a temperature scan so you can tell the person they have a high temperature, that's fine. But you can't stop them from coming in. I mean, a lot of things have to change before that happens. So that's my feeling about that.
Dr. Kasiri?
Sure. So then the last slide, if we can go to slide 9, it just gives you some more information on the SAC collab, which is, as I mentioned, our contract is mainly with Sierra Health Foundation. Slide 9. Hello? Yes, thank you. And on the right-hand side, it gives you a list of the other community-based agencies that are part of this collaborative. And I know it's difficult to read the writing on the left-hand side, but it shows that the kind of services that are provided, such as food, help with transportation, help with income support, and other opportunities. And as I mentioned, as moving forward, the resource coordination would continue, but then we would not continue with the contact tracing or case investigator. That would remain within the county. So that's the end of my presentation.
Okay, thank you. Ms. Evans, how many members of the public do we have in the queue to speak to this matter?
You have 8 callers in queue right now.
Okay, if there are no further questions for Dr. Kasiri or Ms. Edwards or Mr. Wagstaff, there are. Okay, Supervisor Frost?
Yes, Dr. Kasiri, on this collaborative, they're providing support services for residents. Are you providing any kind of educational outreach that can connect these folks with treatments, clinical trials? There's all kinds of very successful treatments for COVID that is actually saving lives. Is there a way that we can invest in or put some systems in place that will refer people to some of those opportunities to be through this collaborative and to our medical community?
Sure, and the best actually way of being able to get information out about treatment would be working with the clinics and the hospitals, because with the staff that are in the community-based agencies, they've been mainly focusing on making sure that people who have to go on quarantine or isolation have the support that they need, as well as being able to make sure that they understand their test results, or actually providing them with their test results. They would not be able to able to talk with more information about the treatments, but as you and I have discussed, I am going to follow up with some of the hospitals in terms of some of the doctors that have approached you so that I can provide that information to them.
Much appreciated. And I'm hoping someday soon that we can find a way to bring some of this information to the entire board, maybe a comment or something, because there's some really positive news out there about treatments that are saving lives. So I'm excited about that.
Yeah, and we can discuss it and see what.
Okay, any other questions of staff before we hear from the public? All right, if not, Ms. Evans.
Okay, please transfer the first caller. Hi, caller, you have 3 minutes. Please start with your comments.
Yes. Rarely does an entity of a government have extra money to spend. I can see those do-gooders with their ideas dangerous, short-sighted at best, drilling at the thoughts of these self-righteous exploits now having funds for their deployments. Once again, the pathway to hell paved by the celebrated good intentions. Look at the dangers already being cast by the so-called pure, and only a few weeks in, mostly people that are healthy finding their way to a lifetime of complications and side effects because they were told it was safe. Where's the funding for their treatment? Now to see all the areas where the vaccine is being administered in the highest concentration are now having the highest outbreaks and infection rates. Could it be the vaccinated are now carriers? Could they be carriers of a more infectious and deadly strain? Proven repurposed therapeutics sure would be a better spend of the money and definitely would save more lives. Do you want to save lives? Be honest. Is that your top priority? Be honest. Or do you wear a mask so you can pretend? Believing the media will keep the sheep's eyes covered. Your careers furthered by big pharma money. Just play along. We the people know you are not stupid. The evidence has been there for months that masks do not save lives in the general public. Is it pride that prevents you from changing course? Or do you have that much fear of the establishment? You know, big pharma, big tech, mainstream media, and the Chinese Communist Party? I don't get it. The simplest compassion should tell you to stop. Now you have this money. You must decide what to do with it. Time's pressing. Perfect excuse for recklessness. And just look, no one is imposing the Constitution. You know that thing that says appointed people can't make laws? You know that thing that says contact tracing is a violation of privacy? You know the Supreme Law thing that says vaccination certificates is a violation of civil liberties and of free participation in commerce? And why be concerned about that religious part of that old, almost ancient document? You know, the Great American Church experience mostly had their doors shut. It's perfect obedience to Caesar. Heck, all you had to do is threaten to tax them. Perfect silence, almost. I can hear a whisper. Soon you're going to hear a roar. How about funding for therapeutics? How about setting funds aside for victims of the vaccine and victims of malpractice? How about funding for people displaced by all these government restrictions? How about funding for care people to be paid to bring necessities to those who are quarantined because they are sick? How about funding to improve overall general health, healthier immune systems? How about free us from this lunacy? Call it a COVID legal fund for the people. Thank you for your time.
Thank you. And the next caller. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, this is Robin Durston. I'm in District 2. I think you should fund the Homeless Direct Service Partners and the Services Not Sweeps Coalition. From what I've seen, the SAC Collaborative doesn't do anything. They are the ones that go out and provide direct services. And I see the same homeless people day after day, year after year, and they keep increasing. They need sanitation services, hand washing stations and mobile showers and garbage service and motel vouchers. They need, when I was at the Poor People's Campaign meeting, they said NorCal Resist tried to get night voucher for one person who was getting released from detention, and they didn't. SAC Collaborative, they were on the phone for 3 hours with all the different agencies, and nobody helped them. So they need to be held accountable for what did they do with the money, and where does it, how many people do they house and feed? Thank you.
Thank you. And the next caller. Hi, caller. You have 3 minutes. Please start with your comments.
Oh, yes. Hi. My name is Liberty. Good morning to you all. What a disaster of today's budget preparedness and discussion, Olivia. How much was actually unspent from the federal and state funds in 2020? I could not possibly keep up. Was it 29.6 or 14, 8.8, or an entirely different amount? Also requesting transparency in the form of publicly available monthly statements as far as how much is spent exactly on what, to become crystal clear to show how the Board of Supervisors indeed plan to spend and serve the county they were voted to work for. Instead of spending millions of dollars on an invisible virus which has not been isolated or reproduced by using cost postulates, the same virus which has the test called PCR, which has never been found adequate to use it as the gold standard to test for COVID. Yet millions are spent on it. And as today's discussion shows, you plan to do the same in 2021. How come the county never considered researching, educating, and recommending therapeutics for COVID? We used to have 2 great doctors available from the Department of Health. Now we only have one, Olivia. Yet neither of them thought over the past 10 to 11 months if there could be other useful options available besides the useless face masks, toxic hand sanitizer, social distancing, shutting down the economy, and destroying the livelihood of millions to flatten the curve. And because time proved that all the measures are mentioned above are useless and wrong, we still had an alleged virus gone rogue in our county and country. What sort of an oxymoron is to save lives by destroying the small businesses and the people of those who created them? On the other hand, I have to give credit to everyone involved. The idea is very clever and perfect way to implement control. Vaccines do not work. If they would, there would not be polio, pertussis, flu around the world any longer. Yet, all energy and money is spent on changing the minds of so many to allow being vaccinated and become the part of the biggest vaccine trial ever. You all are complicit in the worldwide fraud and hoax by standing up and dragging out the emergency health order in this county. There is no reason for me to cite the law. I am sure your attorney has done that already. Phil, let me ask a question personally from you. Will me changing my habits of and start living more healthy, would that allow
Hi,
you
could
to
you
lose
please
some
wrap up
extra
your
pounds?
comments? You've already passed your
Yes.
3 minutes. Thank you.
Okay. Well, Patrick, if I start taking the necessary vitamins, use all the recommended potions on my scalp, will it allow you to regrow your hair? The right answer would be no to either of those absurd questions. This is how ridiculous it is to make the public believe that wearing the mask will
Okay,
save
thank you. Could you
someone else's
please
life.
wrap up your comments?
of you are basically selling out your fellow human beings for a subpar job of controlling a few.
Thank you.
Thank you so
Thank
much.
you.
Please send the next caller. Hi, caller. You have 3 minutes. Please start with your comments.
CDC says COVID has a survival rate of 99.9% for most people in the age group that comprises our school-age children and the working class. If the death rate for most people is less than 0.1%, the only legitimate concern by government should be on hospital capacity. Nothing was presented today that gives anyone a clear picture as to where our institutional capacity stands. We only heard general percentages, but this is too vague. More data must be provided so the public and the board can clearly see capacity and staffing at every medical institution in Sacramento before spending millions of dollars of taxpayer funds. What I really hear the presenters in this meeting saying is, because governmental restrictions are hurting citizens, government needs to spend taxpayer funding to provide relief. In other words, government is trying to fix government. Instead, the focus should be on removing governmental restrictions for a virus, 99.9% survival rate, which is the cause of the people suffering. Things should not be on testing or vaccination of a virus that has a 99.9% survival rate. If any funding should issue, it should be on number one, financial assistance for residents and businesses who have suffered loss because of governmental restrictions, not because of COVID. A relief payment can be allocated to all Sacramento residents, with additional payments to businesses, them stay afloat until the governmental restrictions are lifted. Number two, fund therapeutics. Therapeutics have a high success, and therapeutics would actually decrease capacity since therapeutics can be used at the physician level. COVID is not hurting Sacramento residents, businesses, or our children. It is the restrictions and lockdowns put in place by government that is doing the damage, mostly by Governor Newsom. All to please do what you can to remove the COVID restrictions, which will significantly reduce the need for taxpayer spending and only limit COVID relief and the restrictions. Thank you all very much. New Year.
Caller. Hi, caller. You have 3 minutes. Please start with your comments. Hi, can you hear me?
Yeah. Yes, I can hear you. Can you hear me?
Yep. Go ahead and start. You have 3 minutes.
Yes, hi. I wanted to comment on the fact that county is bringing back retired leadership to lead health services and then with elevating and investing in diverse leadership that already exists. In case anybody needs a reminder, Dr. Cassiere is uniquely positioned to lead health services, particularly during this time, indicating that we can't possibly take the county's public health officer away from her duties during this time is not a sufficient response. You have talented, capable internal leadership that you refuse to promote because they are too busy, yet that they are too capable. This is a great way to have an exodus of talented leadership that see the writing on the wall. The county is more willing to bring back old retired white men than elevate an internationally recognized and overly competent Black female leader to the position. The county just declared racism as a public health crisis. And before you work on racism in the community, let's start in your own house. Just look at the level of scrutiny our resident misers on the board, Peters and Frost, have consistently shown every time Dr. Cassiere comes up to the podium. From things as petty as typos in the presentation that's prepared by staff to everything important like giving staff, like frontline healthcare workers, their much needed and deserved overtime pay that has literally been denied to them this entire pandemic. If this were Dr. Bieliston delivering this presentation, I am certain you would never scrutinize this presentation or anything that Dr. Cassiere has said nearly as badly as you have with Dr. K. Imagine if these miserly fucks showed half as much scrutiny for sheriff's department expenditures as they are for public health, which you have consistently underfunded and understaffed for more than a decade, literally since 2008 financial collapse. Finally, the community expects a transparent, equitable process for the full-time position of health services director. The county has a track record of having processes decided behind closed doors. It is evident appears that like the current culture of leadership, which is again old, white, mostly retired. Look at you, Bruce Wagstaff. That is consistently driving these processes to make it look ridiculously homogenous and cut out people that could actually provide progressive forward thinking within county staff leadership and make county something that's sustainable and desirable to work in. The county should have community representation on the hiring committee and a commitment to transparency around how their supposed values manifest during this hire. And if we can't get that from you, then I'm going to tell it to you straight up. Looking at you, Sue Frost, get off the board, resign. Because you're not in service of the community when you're cutting out people that are already qualified, that are already there, and already have the trust of the community. That's you trying to protect your own certain comfort, your own perspective, comfort, and your political.
Hi, can you wrap up your comments, please?
Yeah, I'm just going to say that this entire conversation is particularly the attitudes and the behavior displayed by Supervisors Frost and Peters is really just emblematic of the deep-seated racism that permeates throughout county culture. And it's really fucking serious, especially when I have family that's currently sick and dying in the hospital due to COVID right now.
Okay.
Do fucking better, and Susan Peters, can't wait for you to go.
Can you wrap up your comments?
Again, get fucked.
Thank you.
Next caller, please. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, this is Leslie. I live in District 1. The Coronavirus Relief Fund revenue should be distributed to Sacramento County small and medium-sized businesses that have been forced to shut down or open at less than full capacity, and employees that have lost their jobs due to this. They are the ones that have been hurt by the government's forced lockdowns. Do you remember 2 weeks to slow the spread? That's how it all started, and it's turning more and more into total government control. We don't need additional funds to be spent on inaccurate testing, temperature checks, staffing, etc., for a disease that can easily be managed by inexpensive therapeutics and has an extremely low death rate. Sacramento County needs to open up. Please give Sacramento County residents their freedom and give any relief funding back to the people who have suffered the most over this ridiculousness. Thank you.
Thank you. Next caller, please. Hi, caller. You have 3 minutes. Please start with your comments.
Thank you. My name is Ethan Evans. I am a resident of District 3, and I work as a professor of social work at Sac State. I want to thank the board for taking up the suggestion at their homeless update meeting to meet regularly in the next few months of the upcoming year to have homelessness as a topic on the agenda. I thought that the discussions of this funding seemed to not speak too much to the folks who are living outside currently. I know in my neighborhood, there's a strip of about a mile, and I think there's about 48 people I counted while passing out sandwiches on Christmas Eve to them who are living in various boxes and tents and etc. And I know from living here that in March, they were not living there. And I left town due to the pandemic to be with an elder father, came back in June, and they were living there, and they've lived there since. My concern is that the vaccine and testing is not going to help them to find other living situations. And so with this relief money, I heard a big chunk of money being used for outreach, but it was very vague. And it's clear that we need coordination and continued funding for sanitation and survival services and protections for those living outside, especially during the pandemic. I'd like to encourage some specificity in this outreach budget to help continue that type of humanitarian effort. And thank you to staff for so much time and short notice to put together some plan. Last comment would be, I tried to find the PowerPoint on the website, and it said it was there, but it wasn't. So it's really hard for the public to see the details through the Zoom screen of what that proposal looked like. Thank you very much.
Thank you. Next caller, please. Hi, caller. You have 3 minutes. Please start with your comments.
Hi, this is Veronica. I'm from District 1. And what I heard today in the meeting is that it's very confusing with the data. There's no updated data on what's going on. Mr. Cerna, you said that there were adjustments that were made to the last budget or the budget that you voted on. What are those adjustments? It seems like every one of you is confused on what those adjustments are, where the money went, and where the projected numbers are, where the funds are needed to be spent. So there's no transparency. It seems like everyone's confused, and we need those numbers on a monthly basis. You need them to make the proper decisions for our community. Secondly, there's no funds, there's no discussion of therapeutics. Please put that on the table. I truly believe in that. And so I'm very concerned with Bruce and Dr. Kassiri because they're confusing you guys with the numbers and the budget, by sending documents with no signature. I mean, that's 101. If they approve something, it needs to be signed. Secondly, not having, Dr. Kassiri said she's not able to pull current numbers or data, then how are you supposed to project or allocate funds if you don't have the local county data? So that doesn't make sense to me. I believe there's a program that was started by the state that you're able to do that quite a few months back. I forgot the name of it. So my question is to Dr. Kassiri, what's going on? How are you not able to project or get the current numbers to know what's going on? Where's the hot spots in our county? And secondly, I believe if I'm right, Dr. Kassiri said today that a shelter was able to quickly respond and isolate the people that were sick and get the COVID under control. If that's true, then why can't we apply the same therapeutics or whatever they did? I guess isolate. It is applied. We're applying isolation to everyone else. So that means we do have the COVID-19 under control. With that statement, I'd like to get more information on that. And please get the current data. Please defer this voting on this until maybe 2-3 weeks later on. That way we'll have better numbers, better data, and you guys would make better decisions for our community. Thank you for your time.
Thank you. The next caller, please. And the PowerPoint is up. We have staff that confirm that, so I'm not sure if they have some other issue going on. And this is your last public comment, I believe. Hi, caller. Please start with your comments. You have 3 minutes.
3 minutes. Wow. I think I've lived a lot listening to this hearing. Thankfully, there are some very intelligent people who have called in prior to my opportunity here. Again, 3 minutes. Wow. I could use lifetimes. 5.6 million going to staffing. Your salaries are secure. while Sacramento dies, while children have no school, while you're telling us that we need to be locked down in case Southern California needs to transfer their ICU patients here to Sacramento. I don't even know what to say at this point because the fraud is so obvious. And yet you people continue. I could take this call in any number of directions. I could talk about vaccines being human rights violations. I could talk about the fact that, temperature scanning devices for which you want to spend $1 million on these clear scan units are a violation of bodily sovereignty, bodily autonomy, that people who already cannot tolerate masks experiencing discrimination on a daily basis. I could talk about the fact that you are violating the citizens of Sacramento's access to public meetings as you can commit disaster fraud. And I'm doing this while I multitask, because I'm locked in homeschooling 4 kids, despite the fact that, I'm paying for all of your salaries, frankly, and all of these services that we Californians aren't getting. Are all of you aware of the fact that you're all public officials? You're all elected officials? Are you aware of the fact that there is a very successful effort underway to recall Gavin Newsom and that any of the rest of you could be next? This is shocking to me that this is what you people are doing. Going on and on about vaccines. Professionals at the World Health Organization Vaccine Safety Summit in December of 19 admitted that scientists don't actually understand how vaccine adjuvants even work. And in terms of this shot, it's not even a vaccine. It's in fact an unregulated, untested, experimental medical product. And that's according to professionals like Simone Gold, MD, and JD. Yeah, she's both. I will never submit to this shot. There are so many people in this community who will never submit to this shot.
Can you please wrap up your comments, please?
Excuse me? That wasn't 3 minutes.
It was 3 minutes, ma'am. Could you please wrap up your comments, please? Thank you.
The Universal Declaration of Human Rights was adopted in 1948 after World War II because of the medical and ethical horrors. It reads, everyone has the right to freedom of thought, conscience, and religion. This right includes freedom to change his religion or belief and freedom, either alone or in community with others.
Thank you so much. We may have one more comment. Someone is stuck in a different queue, and I'm having staff check on that right now. Do you mind hanging on just 1 second, please?
Sure.
Thank you. Hi, caller. You have 3 minutes. Please start with your comments.
Hi. Open up the county. Terminate the unnecessary shutdowns. Defy Gavin Newsom, who does not have the right to end the state of California. Educate the public on therapeutics. 2, you have the first-hand experience in emergency services from your studies and being an emergency RN. Even if you haven't practiced for a while, your help is needed. The people are crying out for you. We do not consent to vaccination, mask wearing, hand sanitizer use, social distancing, elimination of small businesses, and shutdown of the county, state, and ultimately the country. It is your civil duty to end emergency health orders as soon as possible. The 2 weeks have passed over 10 months ago. And at this time, I am calling an audit to confirm the numbers of individuals who passed away in 2020 in Sacramento County, to re-examine how many of those exactly died from COVID, with COVID, or possibly totally unrelated to the virus. And I also do not consent to the 100% waste management fee increase, which the BOS is voting on January 12th, 2021. That's all.
Okay, that concludes your public comments.
Okay, thank you, and thanks to everyone that took time to patiently wait to address the board I guess it's afternoon now. All right, so it's back in front of the board in terms of what, if anything, we want to consider or deliberate relative to the staff recommendation, the opportunity to adjust it. I'll start it off. Everyone heard my comments earlier about at least my rationale or reasoning behind looking at a portion of the 7.8 million that's been identified solely for testing. I would like us to see us at least do something of what has been provided from some of the service providers in terms of their detailed proposed programming. Do something for the child care providers. And then I also had a question, and I don't know who it's best directed at, perhaps Dr. Kasiri, but in terms of the proposal that the Latino Economic Council has provided staff, do we know whether or not each of those elements of their proposal could be deployed, applied, independent? So, for instance, if we weren't able to fund, or if it was the will of the board not to fund the total 4.77 million, could we, for instance, look at just providing funding for direct services or providing funding for small businesses? I don't know who's again prepared to answer that, but I'd like to understand that a little bit better.
Yes, the way that they submitted their proposal, each was separate, so we could do that, and we would negotiate with them.
Okay. So having heard that, I'd be interested in doing something under the rubric of direct services or small business assistance that the Latino Economic Council has developed, as well as some support for the Child Action Inc. Proposal. And I think, if there's interest by others to do maybe more than just the 1 million for food security, I'd be certainly open to that. But those are my thoughts, just to kind of inspire some discussion.
Mr. Chair?
Yes, Mr. Toll.
Yeah, I wanted to ask a question before I commented. The note on the slide, on slide 8, said that there was an additional request that was expected from the Sacramento Inclusive Economic Development Collaborative. Did we get something along those lines? I didn't see anything in any of the materials either that came in separately, or I'm not familiar with that particular request. Was something submitted, Dr. Kasiri?
They sent an email, but there was not enough detail for us to be able to provide in terms of what they wanted to do or the dollar amount. So
Okay.
I asked to just include that line so that you're aware that that came in, as well as the one for the parks.
Okay. Yeah, I did see the one for the parks. I know we had a couple of park districts, and I think they pointed out that without a specific request for all the districts, that there were certainly impacts that they were encountering relative to resources and expenses for some of those districts. So if I could ask you, Mr. Chair, so your proposal was to set aside, again, without all the specifics, Phil, how much were you asking?
Well, certainly want to hear from the rest of you in terms of what priorities you are considering. That's comes out of what's in front of us. But I'd be open to assisting both the direct services component and small business assistance component of the Latino Economic Council proposal, as well as up to the entirety of what Child Action Inc. is together for childcare.
Yeah. All right, well, that's helpful. So I just offer a couple of quick comments then. One, I do think when it comes to the food security, that what we've done obviously successfully with the Dine at Home program to be able to sustain that in ways that make sense. And it sounds like we're going to have a chance to revisit that again after the first of the year. But I would like to see that. I think obviously doing, in addition to that, something that would assist families as proposed here. I'm supportive of that. And as maybe the comments back earlier in the meeting, that to do something that would give us some certainty relative to funding for this, for say at least a 6 or 8 week period, so we know, and it gives us, some time to then consider where we might have other adjustments as more is known relative to federal and state funding and other opportunities that are available. And I think some direct assistance. We talked about this, some of the points being made here today, that if there are ways to assist beyond obviously the desire and need to allow folks at the appropriate juncture to reopen, but I think to provide some assistance for folks who have been impacted, obviously beyond the, certainly the restaurants that have been able to participate in these programs. I think that there's some opportunity to partner up as we have with others. And I think certainly the child care proposal is a reasonable one that supports folks who obviously provide those services, but also I think for some of the essential workers and others who have continued to need those services, but some of the providers obviously have struggled to stay afloat. And I think Child Action has pointed that out in several pieces of correspondence to us. So I see some opportunity here to maybe set aside some of that was carved out for the testing portion of this, but make sure that we have the testing through the end of February, and then allow Dr. Kasseri and Ann and Mr. Wagstaff and others to be back to us, hopefully maybe as soon as January 12th, but certainly during the month of January, to have some further discussion about how we can make either additional adjustments and or accommodate some of the initiatives that are included here today, but also obviously part of what we've been doing now for several months. So, but those are my comments. Thanks.
Okay. Others? Supervisor Frost.
I kind of feel like we're making a decision before we have all the information. So I'm a little bit I'm a little bit uncomfortable about that. I do support the in-home food programs. They benefit the restaurant and they benefit, underserved, but at the same time realize that there's a few people that get approved on those programs, and the message I'm getting in the communities and within the restaurant community is that there's a few that get on that and it's really great, but the restaurants that aren't providing that don't benefit. So it only goes so far, and I know all this stuff can only go so far, and I do think it's a great program. There have been some other ideas that have come across my desk in the last couple days relating to ways that we could support small business in a way that would incentivize small businesses, and if they're going by the COVID regulations, that they might qualify for a grant program and setting aside some funds for that. I would like to have that conversation, and it's a little bit premature because we don't really know all the resources that we're going to have, but we will in the next 4 weeks, I think, know more. I believe that testing is important. There is a timeline from the date you test positive on COVID to some really impactful trials and ancillary treatments that are preventing hospitalizations and saving lives. And I think it would be so great if we could find a way to explore some of those treatments. One of them is fluvoxamine, which I've been recently looking at, that had 100% success rate at a trial that took place at the Golden Gate Fields in Berkeley. But it was basically, there were something like 300 individuals who had been exposed to COVID, and 65% or so went on this trial, and then the other 50% decided to use the placebo, and the ones that took the medication had 100%, 0 to no symptoms. And of the ones who took the placebo, 1 person died and 2 people ended up in the ICU. So they're having some success with some clinical trials right now that are saving people's lives and reducing the number of people in the hospital. And I think if we, as a board, could begin to explore treatments, that might be a way to reduce our hospitalization capacity, free up hospitalization capacity, and begin to, in a very careful, managed way, begin to be able to open up by way of providing treatments and cures that augment the vaccine, which is really important. I think the vaccine needs to go to the most vulnerable to save the most lives, the most at risk to save the most lives the quickest, and that we need to find a way to have the conversation around treatments and ways that we can, thinking out of the box, not just managing, don't get exposed, don't test positive. If you do test positive, go home. But how can we find a way to respect this virus and work with it, and use the greatest? We have great minds who are working really hard for treatments that are actually working right now. And so I want to, if there's some programs that need to, I can support a lot of this, but I wonder if there's a way we can just come back with a conversation when we have all the information in front of us, and we have the numbers, and we can actually see what we're looking at, the big picture, the whole picture, to make an informed decision in that way. That would probably be my preference, and so that's and I was okay with Supervisor Kennedy's thoughts regarding maybe extending some of these programs for a month or two, and then coming back when we have the bigger picture, so that we're not making big decisions with partial information. That doesn't seem comfortable. So that's kind of where I'm coming from.
Okay, thank you.
And I'll make a comment.
Okay, go ahead.
I am a big believer in the testing. I understand the idea that the reality that vaccines are coming, but for the majority, they're not available for several months. They're going to the most vulnerable right now. And so the majority of our population isn't going to be vaccinated for, I'd say, I have no idea. Let's just say 4 to 6 months. And the 2 programs that are already on here, the food programs and the testing, really only get us about 4 months down the road. And so I am not in favor of changing these amounts. And that said, in going on to other proposals, one, I don't know how businesses were supposed to find out how to propose for this money. And so I feel it hasn't had a full airing. And a couple of the, I'll say companies or requests, we don't have any details on their background. I don't know typically when we get a staff report, it says this is going to the Asian Chamber. They've shown the ability to do this, and then we've got information on the touchless temperature scan, and I think we're getting, and you know, some of the others here too, those should be things that come to the board on a separate board letter and request, not just, and so we'd have details. I'm just very uncomfortable doing stuff without details. Plus, I feel that we need to stay strong on the food programs and the testing. That's where I am. Thank you.
Thank you. Supervisor Kennedy, any comments? You're muted. Is there a way we can unmute him? There we go. Right now. Yeah, there we go. Yep.
Yeah, you know, I understand where you're coming from, Chair, when you talk about the testing issue. But I'm not willing to, at this point, I'm not interested in really. I guess part of what I'm feeling here is that I feel a little uncomfortable making medical decisions. You know, 4 years of law school didn't teach me to feel very comfortable with that. So, you know, I am inclined to follow the advice of the people that we consider our experts, and Dr. Kasiria, of course, being one of them. But I'm not ready to abandon, or that's a strong word, I'm sorry. I'm not ready to decrease our focus on testing at this point, simply for what, you know, as Susan said earlier, and what Dr. Bielenson said very clearly last time he spoke to us his last time before the board, and that was that, you know, we're not looking at everybody being vaccinated until July. So I feel it's premature to decrease our emphasis on both testing and tracing.
Okay, thank you. I'd like to ask Dr. Kasiri, because it was just characterized by, and please correct me if I think this poorly, Patrick, but I'd just like Dr. Kasiri to respond to what it really means if we were to take some of the resources for testing and apply them elsewhere in terms of the kind of the practical effect.
I appreciate it. And by the way, I don't mean to be argumentative here. I'm trying to learn as well. So
I respect that, and I'm not a medical expert either, so that's why I'm asking a medical expert now what that practical implication is.
Mm-hmm.
Dr. Kasiri, are you there? Dr. Kasiri, we can't hear you if you're speaking.
Dr. Kasiria, can you hear me? Dr. Kasiria, can you hear me?
Looks like there's an issue.
Yeah, I keep turning her mic on and off. I mean, I'm turning it on, but the system keeps turning it off automatically. So do you mind if we take maybe just a 5-minute recess so that I can have DTech fill me in on what's going on?
Yeah, we'll stand in recess for, let's make it 10 minutes.
Okay, thank you.
Okay, I see that the broadcast is on, so can we resume?
Yes, you can.
Okay, call back to order this meeting of the Sacramento County Board of Supervisors for Wednesday, December 30th, 2020. Madam Clerk, will you please call the roll and establish quorum?
Yes, Supervisors Frost. Here. Kennedy.
Here.
Natoli.
Here.
Peters.
Here.
And Cerna.
Here.
Yes, you have a quorum.
Great, thank you. Dr. Kasiri, I don't know if you heard my question earlier, but I think Supervisor Kennedy brings up some legitimate concerns about testing, some of which I think were articulated by others during the course of your presentation. But let me just restate the question for those that might be watching. So I'd kind of like to know a little bit better the implication of taking a fraction or a portion of the 7.8 that public health has identified strictly for testing. And let's say we were to use 50% or 25% of that amount for other purposes. What practical implication does that have for public health? And does it really, in your estimate as a medical professional, does it really compromise us in terms of our ability to, responsibly respond to the pandemic?
The budget that we've given you is for a period of time as we transition to the state system, but our plan, and I'm planning to communicate with the staff who's in charge of this, is that we will accelerate that and so be able to maintain the same level of testing, but at the same time be able to free up some money. In my estimate, I think beginning with 25% is doable. And then definitely as we get to know more in January, we will be able to make additional adjustments.
Okay, thank you. All right. No, so I see Supervisor Kennedy's shaking his head, so I think we both appreciate the response. So with that said, I would like to make a motion. And given what Dr. Kasiri said, I'm certainly sensitive to her professional advice, as are all of the board members. I'd like to suggest that that we use $1 million to assist Child Action Inc. in their efforts to provide child care for families in need, and $1 million for direct services pursuant to the proposal that the Latino Economic Council has delivered to our staff. That's obviously a total of $2 million from the $7.8 million. And it puts in motion with some rightful sense of urgency, providing those resources to those two groups for those stated purposes. And then it's also part of the motion. I'd also want to include in it that when we reconvene next year on the 12th, assuming that we know more about how much federal assistance we will have available to continue responding to the pandemic, that we revisit some of the remaining outstanding requests for resources from the county for these groups and other groups as they might come in for various parts of pandemic response. So that would be my motion.
I'm sorry, there's a lot of feedback and echoing. Could you please repeat the motion? You don't need all the explanations, but I got you want $1 million for childcare, but then I didn't get the rest. Sorry.
Then $1 million for direct services pursuant to the proposal by the Latino Economic Council.
Thank you.
And that's it leaves a balance of 5.8 for testing. The $2 million is basically a 25% adjustment pursuant to what Dr. Kasiri just mentioned, that would be doable. And then at the last tail end, of course, would be to revisit the balance of these requests on the 12th of January.
And if I could ask a question, so the chair's motion includes the was it the balance to the $1 million for the family meal Sacramento program?
Yeah, it does. Yeah, of course. Okay. Sorry, I made that clear.
Yeah, and I just would say that I think as a part of the motion, I think coming back, frequently, certainly January 12th to be our next regular scheduled meeting. But as we know more, again, I still am very interested in the dine at home program, as others have talked about, and certainly maintaining some of the food and testing both. But I think it's a reasonable amount of what Dr. Kassiri said. So I'd second your motion, Mr. Chair.
Thank you. Okay, we have a motion on the floor and a second.
I have a comment.
Okay, yeah, Supervisor Peters.
I'm not going to be able to support that motion because I don't have any information on the Latino Economic Council. I'm just unaware of the group. I don't know what their goals are or how they would accomplish this. And I would make a substitute motion to stay with the staff suggestion on the food programs and the testing and the amounts of for 4 months, and on the testing and the $1 million in the food program.
Second.
Okay, we have a substitute. So we'll take up the substitute motion first. Madam Clerk, can you do a roll call vote, please?
Yes. Supervisor Frost?
Aye.
Supervisor Kennedy?
No.
Supervisor Natoli?
No.
Supervisor Peters?
Yes.
And Supervisor Cerna?
No.
And the motion fails.
Okay, we will take up the main motion. You do a roll call vote, please.
Yes. Supervisor Frost?
No.
Supervisor Kennedy?
Aye.
Supervisor Natoli?
Aye.
Supervisor Peters?
No.
And Supervisor Cerna?
Aye.
And
the motion carries with Supervisor Frost and Peters voting no.
And Chair Cerna, I'd just like to go on record as saying I voted no because I feel like I need more information in order to make an informed decision.
Okay, so noted. Okay, thank you. We do have some off-agenda speakers, do we not?
Yes, we do. Please transfer the first caller.
How many do we have?
As of right now, I believe that we only have one caller. Someone hung up during the recess, and so I still have it open if they were going to call back. Hi, caller. Please start your comments. You have 3 minutes.
Yes, my name is Barbara Tyler, and I live in Susan Peters District, and I have for over 40 years. And I just wanted to respond. I wanted to respond to her comments about people going into businesses, getting temperature scanned, and getting into these altercations. I have lived in this area. You can look around what's in our area: Safeways, Winco's, Walmart's, Bel Air, everything. There's no one business that is doing any temperature scanning. I don't know if she's not in touch with her who she's representing, but I feel that that's not a good thing because that is not happening. We're all being forced to wear masks, whether they work or not. I mean, if they worked, I don't understand how their virus is spreading so rapidly. But I just really would appreciate if she could be in touch with her district, the people in it, and really go out in the community and see what's going on. The other thing that I'll bring up, it was, off of that, but I believe that the statistics being reported on hospitalizations and death are certainly skewed, that they are reflecting people that have no real connection to the coronavirus, however it's being put on death certificates and all kinds of hospital admission, because hospitals are getting additional funding if they treat people relating to the COVID-19 virus. I mean, I myself had an experience where a person was in a motorcycle accident. He was brain dead, and they had him on life support till they could get a hold of the family. And they put that on his death certificate, and his family's been fighting it ever since. So he didn't remotely die of it. It had no connection to it, but yet it was put on his death certificate. So the public needs proof that these figures and facts and deaths and hospitalizations and positive test rates are good. Because another thing that has happened is people who have gone out to be tested have walked away and not been tested. Maybe the wait was too long or whatever. They're getting called weeks later saying, oh, your test was positive.
So I just have to put out there that there is a lot of problem with these statistics that are being reported. And the final thing is, I don't appreciate businesses enforcing Newsom's mask guidelines. It shouldn't be put on them, as Ms. Peters says. It should not be put on them. It's not their job to enforce the mandate. It's their job to do it. They're told to stay open, not to police us, wrestle us, and do all the things that are happening. So I just wanted to put that out there. And for Ms. Peters, I write to you all the time. I get little to no response. Maybe I'll get something saying, oh, gee, I'm out of town, so somebody else is going to respond to you. But you really need to get in touch with what's really going on in your community, not just make up stuff about people getting temperature things and wrestling around, because that's not happening. Thank you.
I'd like to respond to that, please. To the caller, I've lived in the district for 60 years, and I shop at all of the stores you mentioned, and those are my personal experiences, including one about a week ago when a man leaving Rayleigh's gave everyone the double index finger for giving him trouble about wearing a mask. So this is happening, and I do know what's going on in my district. Thank you.
Madam Clerk, do we have any more callers?
Have any more callers?
I'm sorry, that was no more callers?
You did not callers.
Okay. Then we're on to CEO comments. Is Ms. Edwards still with us?
Yes, I'm still with you. Thank you. I just want to say that we will come back to you when we have enough information to bring back to you. I am not yet confident it will be on January 12th, but we'll get it to you as quickly as possible.
Great. Thank you.
Thank you.
All right, very good. Any comments by members of the board? I think Supervisor Frost beat Supervisor Kennedy to the punch. So Supervisor Frost?
I just wanted to request to Ann, when you do come back, can you please come back with a traditional budget request that has, numbers and has everything together so that we can see what we're looking at.
Yes, we can do that. That will take a little bit more time. For example, with some of these proposals that we have received, we have not received fleshed out, very detailed budgets. So we will ask for that and then be able to present that to you as well. It may add a little bit of time.
Well, I'm talking about, in the past, if we were, had a budget at the county level, we had, our budget was flushed out. We knew what numbers were going toward what. And on projects, staff reviewed projects and sent out RFP and made a decision on who they were going to go with and what was the most prudent way to spend taxpayer dollars. And then they brought it to us. We didn't have to see all the details of those other budgets, but what I'm saying is I want to see it in the way that we have traditionally done it.
We'll make every effort to do that.
Thank you.
Very good, thank you. Supervisor Kennedy.
Yeah, I simply wanted to wish everybody a very hairy new year.
You have to admit, that was a choice comment.
Really appreciated that.
Supervisor Natoli.
Yeah, thank you, Mr. Chair. Certainly wanted to just thank all those who pulled this together today, and this is probably the latest in the year in any given calendar year that the boards come into session the day before New Year's Eve. And I know at the conclusion of last meeting I did make a few comments, but I wanted to acknowledge certainly Susan's service on this board. And when we next come into session, obviously there'll be a swearing in for the supervisor-elect. But again, I wanted to thank Susan. She and I have served together for all of her 16 years on this board and logged many, many hundreds of hours in session. And I just want to extend best wishes certainly to all of my colleagues and all those that are, participating today, but also certainly to Susan. Yeah, this will be the last meeting I think we'll be in session together, at least as board supervisors, unless you call a special one for tomorrow. So, which I doubt is doubtful. So, anyway, thanks a lot. Best wishes, Susan.
Done with special meeting. Glad to hear that. So yeah, I'll conclude and just again thank all our wonderful staff for taking time out of their holiday season as well to scramble and get us the information that I think made today's meeting a productive one, regardless of how we voted. I think we all have a better understanding, I think, of where we're at as the calendar turns and the pandemic continues and our response continues as well. And again, to all of our public servants and the county family, I want to offer my sincerest thanks on behalf of the board. I want to wish everyone a terrific new year. I think 2021 has got to be a better year than 2020. So let's all keep our toes and fingers crossed and look forward to seeing everyone next year. So again, thank you, everyone. Thank you, Flo, for all your assistance and that of your staff. You guys did a wonderful job today. I know it was difficult.
Thank you. Thank you.
All right. If there's no further business.
Patrick.
Oh, no, I think he was just reaching for the off
Oh,
button.
he's waving. Oh, okay.
All right. If there's no further business before this board, we are adjourned. Thanks, everyone.
Happy New Year. Thank you.
Happy New Year.